In the year of 2011, I was diagnosed as having cancer in the lower part of my mouth. It was probably the biggest shock of my life.
When I go to work, people look at me on the train, when I can't eat normally, or some people don't understand what I'm saying, drink with a straw. So I reckon the impact is probably still ongoing.
But it doesn't have to be like this. Over the past few years, the Head and Neck Cancer Foundation has been at the forefront of developing pioneering technology that can help surgeons detect the cancerous tissue better, improve the patient's chance of survival, and provide much less visible surgery, leading to a better quality of life afterwards.
It's going to be years before they cure cancer. In the interim, we have to treat it. So we want to make that as palatable as possible. We want to get the diagnosis early, the treatment neat and tidy, and not leave people damaged like we are at the moment.
31 patients are diagnosed with head and neck cancer in the UK every day. 60 to 70% of head and neck cancers are only detected in the later stages of the disease. 3% of all cancers are found in the head and neck.
A sentinel node biopsy can be done simply through an incision which might be 2 or 3 centimetres in size and can be hidden in a crease in the neck.
The most common way cancer cells spread is through tiny channels that drain fluid from the cancer to local lymph nodes. These nodes act as a filter that catch tumour cells. The first node is called the Sentinel node. A Sentinel node biopsy tests to see if there are any cancerous cells and if there has been any spread by injecting a fluorescent blue dye and tracking its progress. This groundbreaking procedure saves the 75% of patients whose cancer hasn't spread from having to go through needless, life-changing surgery, and helps ensure a higher rate of accuracy when providing a potential cure for those remaining 25%.
I was just so relieved that I had been referred to Professor McGurk, who is sort of pioneering the use of SNB with oral cancer.
Knowing that they pinpointed the actual location of where the cancer had spread, that was and still is quite a relief.
Unless I actually mention it to people, they don't even know that I've had tongue cancer, because this is so small and it falls under here.
If you'd like to donate to the Head and Neck Cancer Foundation, then please go to hncf.org.uk.